not from a medical field or not from a science field, knowing about diabetes mellitus, the different types of it, how it affects your body, the causes of it, how can you have a healthy lifestyle beside having diabetes mellitus. We'll discuss that in today's session. Okay, this is not from the textbook. So diabetes, it is a condition that happens when your blood sugar or blood glucose levels are too high. Okay, soon after you have food, there is an immediate spike in your blood glucose level, which comes down also immediately. Okay, and it stays up for quite a big time, and it takes a longer time to come down. If you have something very sugary, not a food, just something sugary, what happens is that normally your blood glucose level will spike up, and within 15-20 minutes it will start coming down. Okay, so you will have a sugar crash, and that is a normal way. In diabetes, what happens is that the blood glucose level shoots up high above normal, and it stays high for a pretty long time, 2-3 hours, or even after 2-3 hours, the blood glucose level doesn't come down that easily. So that is diabetes. So it develops when your pancreas does not make enough insulin at all, or that is one type, or your body isn't responding to the effects of insulin properly. Okay, either your pancreas are not making enough insulin, or the pancreas are making enough insulin, more than that is necessary, but your body cells are not responding to it. Okay, so these are the two major types in diabetes. So diabetes can affect people of all ages. Most common form of diabetes, which is lifelong and chronic, usually happens in adulthood. Okay, and the type 1 diabetes, that is juvenile diabetes, it usually happens in children because it's an autoimmune condition. And all forms of diabetes are manageable with medication, insulin, and also lifestyle changes. It is a manageable condition. Okay, just because you're diabetic should not be a cause of death. Okay, diabetes is responsible for a domino effect of lot many chronic disorders coming after diabetes if you do not have a healthy lifestyle. Okay, but even with having diabetes, living people who are living with diabetes, if they focus on their diet a bit, they do some lifestyle changes, they can still live a very healthy lifestyle. Okay, glucose mainly comes from carbohydrates. Okay, you don't get glucose from fats or protein, it is from carbohydrates in your food and drinks, and it is the first source of energy, because to get energy from glucose, your body does not have to do a lot of work. Okay, it's easy energy, and whatever is easy, the body will try to use it up first. Okay, the second priority will be the fat, energy from fat. Okay, so your blood carries glucose to all the body cells, and the cells use the glucose for energy. Glucose is taken up by the cells, and insulin, the role of insulin is to knock the door. Okay, insulin will knock the door and push the glucose inside the cell. You have to imagine this situation. Okay, but what happens in diabetes or in insulin resistance, insulin is knocking the door of the cells, but the cells can't hear it, they are not responding to it. Okay, and if the cells don't open the door, how will the glucose get in? So glucose will stay in the blood for a long period of time, and that will cause some other inflammatory responses in your body. Okay, so that is what diabetes is. So when glucose is in your bloodstream, it needs help of insulin to reach its final destination. Okay, if your pancreas is not making enough insulin, or your body isn't using it properly, that like the cells are not responding to insulin, glucose has nowhere else to go, it stays in your bloodstream. Okay, and glucose is not supposed to stay in your bloodstream for a long time. Soon after the food is digested, glucose is taken up by the blood, and it tries to deliver it to all possible cells as possible. Okay, the blood will try to get rid of glucose at its regular pace with the help of insulin. Okay, but when the cells are not responding to insulin, or the pancreas are not making enough insulin, glucose have nowhere else to go. They pile up in your blood and cause hyperglycemia. Hyper means high, high levels of glycemia, glucose in the blood, high levels of glucose in the blood. Okay, so that is how people who have diabetes, they have high blood sugar levels. Okay, so over time, having consistently high glucose level can create health problems, usually inflammatory health problems. Okay, because glucose or sugar, okay, they are highly inflammatory in nature. Okay, they also act as free radicals. Glucose can also act as free radicals. Okay, if the cells are not taking it up for energy purpose, it can go and harm other cells. It can cause inflammatory response in your body. Okay, like heart problem, heart damage, heart muscle damage, nerve damage, eye issues. That is how in the final stages, when you are suffering from diabetes from the past 20 years or so, okay, senior citizens who are suffering from diabetes from they have a long history of diabetes. Okay, usually they will end up suffering from neuropathy, retinopathy. Okay, these disorders will follow up. Why the restriction to insulin takes place? It's lot many factors, not just one factor. Lack of physical activity, hormones, okay, hormonal imbalances, poor dietary pattern from a long time. Okay, so there are lot many external factors that is causing the cells not to respond to insulin. Okay, we'll see that later. So what are the types of diabetes? Type 2 diabetes, it is the most common type. With this type, your body does not make enough insulin, or your body cells don't respond to insulin. Okay, so it's diabetes will always begin with insulin resistance. Okay, the cells not responding. Cells are resisting the insulin. They are not listening to insulin, not opening the doors for insulin so that it can push the glucose in. Okay, so this is the most common type of diabetes, and it mainly affects adults, and children can also have it. If they have some serious dietary issues, children can also have type 2 diabetes, but in kids, usually we have seen type 1 diabetes. Pre-diabetes, so this is the stage just before type 2 diabetes. So here you are suffering from extreme insulin resistance. Okay, your blood glucose levels are quite higher than normal, but not high enough to be officially diagnosed with type 2 diabetes. Okay, there is a level that you cross, the blood glucose level. If you cross certain level, that's when we classify a person as a type 2 diabetes patient. Okay, otherwise, even if you're in borderline, we call that person as pre-diabetic stage. Then you have type 1 diabetes. This type is an autoimmune disease in which your immune system attacks and destroys the beta cells of the islets of Langerhans in pancreas. Okay, pancreas have islets of Langerhans. That's a tissue, that's a type of cells. There are two types of cells in pancreas, alpha cells and beta cells. Beta cells are supposed to uh, secrete insulin. Alpha cells are supposed to secrete glucagon. Okay, both have the function of regulating the blood glucose level in your body. Insulin is supposed to reduce the blood glucose level. Glucagon is supposed to increase the blood glucose level. Okay, they work in a counteractive way. So when the insulin producing cells, beta cells, are destroyed in the pancreas, okay, it could be autoimmune or other reasons as well. And if the child is suffering from certain chronic infection, the bacteria or virus can also go and attack the pancreas. Okay. Up to 10% of the people who have diabetes, who are diabetic, are type 1. Okay. It is usually diagnosed in children and young adults, but it can develop at any age. Okay. Autoimmune disease can develop it at any age, but usually kids are affected by it. Okay. Then you have gestational diabetes. So this happens in pregnancy. Before pregnancy, there was no issues. Okay, maybe the woman was insulin resistant. Okay, or she was suffering from PCOD or hypertension, any such diseases. but she was not having diabetes at all. But as soon as she got pregnant, her blood sugar levels became unstable, and then the woman will be diagnosed with gestational diabetes. So it usually goes away after pregnancy, soon after you have given birth, and when your hormones are coming back to normal, it usually goes away. But if a woman has suffered from gestational diabetes (GD), there are high risk of she developing type 2 diabetes later in her life. It could be mid 30s, early 30s, 40s, okay? At any stage of her life, she will be having this risk of developing type 2 diabetes because she had gestational diabetes during her pregnancy, okay? So how common is diabetes? Type 2 diabetes is most common form. It represents 90 to 95% of all diabetic diseases. About 537 million adults across the world are suffering from diabetes. Okay, and this number is not going to reduce, it is going to rise. Okay, it is going to reach 643 million by 2030, in the next 6 years. Okay, by 2045, it could be 783 million. So the numbers, the, the prediction, the forecast is the numbers are keeping, it is increasing. Okay. So what are the symptoms of diabetes? Increased thirst, polydipsia. That is the medical terminology of it. Polydipsia, increased thirst. Poly means so much, more than one. Okay, more than two. That is poly. And dry mouth and increased thirst. That is one sign and symptom. Because this is also why you are having an increased thirst. One of the reason is your blood wants more water to dilute itself because the blood has high glucose level. Okay, if you drink more water, you will be more hydrated. Blood plasma will have more hydrogen ions to dilute the additional glucose that it is undergoing. Okay, so that is also one of the reasons why you suffer from increased thirst. Then you will have frequent urination with increased thirst, with having too much of hydration. Obviously, kidneys will be functioning, over functioning, and on top of that, kidneys also need to get rid of the excess amount of glucose. Okay, so kidneys have to get rid of the additional water you are drinking because of increased thirst, and along with that, lot of glucose that has been, you are suffering from hyperglycemia, so the kidneys also have the function to remove whatever is too much in your blood. Okay, so the frequency of your urination also increases. Fatigue, tiredness, because cells are not responding to insulin, cells are not getting glucose. If the cells don't get glucose, how will you get the energy? Energy will not be, mitochondria will not be able to produce energy. Okay, so the person will have no lack of energy, they will be tired always, but fatigued. Blurred vision, because it affects, it's an inflammatory situation. Hyperglycemia is an inflammatory situation, so your eyes are also at the risk of getting damaged like tissues. So blurred vision. Unexplained weight loss, because now the cells are not responding to glucose. Okay, so what is the second source of energy your cells can utilize for survival in your body? What is the second source of energy that the cells are left with for survival? It's the fat. Okay, glucose is there in your blood, but cells are not responding to it. And what will the cells do? Okay, I'm not getting any glucose. I need to survive. I can't die off like this. Let's break down the fat. Let's use up the fat for survival. And that's how people who have diabetes, they lose a lot of weight because the fat in their body is getting consumed for energy, but the blood is still at a high glucose level. Okay. The numbness or tingling sensation in your hands and feet, this is a sign of neuropathy. Okay, and underlining this is an underlying sign that neuropathy have begun. Okay, or you are at a risk of developing neuropathy sooner or later. That is the numbness and tingling on your hands and feet. That is the nerve endings. Okay, your peripheral nerve endings are slowly getting damaged by high blood sugar levels. Okay, slow healing of sores and cuts. Glucose in the blood will not allow, uh, because it is inflammatory. Okay, just imagine if you have a wound. Okay, if you have a wound somewhere, a small wound, you keep scratching that wound, will it heal soon? You keep scratching, you keep poking your wound. Okay, will the wound heal? No, the same thing is happening internally. Okay, not externally, internally. You have a wound cut or cut any somewhere in the body, but at an internal level, and the skin that is around that wounded area, high blood sugar level is there, and the sugar molecules, the glucose molecules, are inflammatory in nature. Okay, so it is causing more inflammation. Okay, so the wounds won't heal sooner. Frequent skin or vaginal yeast infection, again the immunity also falls down. So it's very common for people to have vaginal yeast infection or skin infections. Abdominal fat is not caused by diabetes. Abdominal fat can cause diabetes. That is a difference. Okay, it's not that people get diabetes and they have abdominal fat. Abdominal fat is very hard to lose. Okay, abdominal fat is your visceral fat. Visceral fat is very hard to lose. Okay, when you are dieting, okay, when you are dieting and when you are on a low fat diet, the subcutaneous fat that you have, fat that is just lying under the skin, okay, these are the fats that will be used up first. You will lose subcutaneous fat first, not the visceral fat. Okay, what do you mean by visceral fat? What do you mean by visceral fat? It's a fat that protects your internal organs. Okay, and it is of great importance. Your vital organs are of great importance, and the fat around it is of great importance. Your body knows it. Okay, so you will see this phenomenon in diabetic patients, that even though they are losing weight, they are losing their face weight. Okay, their arms, their legs, their thighs, but the stomach weight will still be there. And why they still and why it's not that every diabetic patient will lose their weight. Okay, if your lifestyle doesn't change, you keep on eating food. Okay, there is high level of glucose in your body, high level of glucose in your blood. Excess of glucose will be converted into what? People who have studied carbohydrates chapter, excess of glucose in the blood will be converted into what? Too much of glucose will be converted into what? A certain degree of glucose can only be converted into glycogen, because glycogen is stored in your liver and in your muscles. They have a specific capacity. Okay, when the capacity of your liver and your skeletal muscles are full, they cannot store more glycogen, but the blood is still not reduced of glucose. The blood still has glucose. What will happen to that glucose? That glucose will be converted into fat. Okay, from one side you are losing the fat is being utilized up, but your diet is not changing. Okay, you're always hungry, cells don't have energy, you're always hungry, you keep on eating food. Okay, cells are not using the glucose, it's converting that additional glucose back into fat, so it's a vicious cycle. Okay. So causes of diabetes, insulin resistance, as I mentioned, insulin resistance, when the cells don't respond to insulin, they have they shut their doors towards insulin. So glucose also will not enter the cells. No glucose, no energy. Okay. So type 2 diabetes, it mainly results from insulin resistance. Insulin resistance happens when the cells in your muscles, fat, or liver don't respond as they should to insulin. And a lot of factors contribute to insulin resistance. Either you are obese, you lack physical activity, okay, your diet is carbohydrate and fat rich diet, PCODs and PCOS that causes hormonal imbalances. Genetically, you have a predisposition of developing diabetes or insulin resistance. Certain medications can also lead to insulin resistance. Okay. And also, like, if you want to over if you are you know that you are in a stage of insulin resistance, you're not yet diabetic, but if all the symptoms of insulin resistance, mm, you can relate to, okay, soon after having food, don't sit. Make sure you walk for 15 to 20 minutes just within your home, anywhere, just walk for 15 minutes. Or don't sit, just do some not heavy exercise, because then you will vomit, but brisk walk. Go for a 15 minutes walk just soon after having your food. Okay. Why? When your cells are active soon after having food, when your cells are active, they will respond to insulin. Okay. When the cells are active, only then they will stay awake. Otherwise, they go into a state of comatose. They don't respond. They don't know who insulin is, what has to be done. Okay. But when the cells are active, they are alert, and they are more receptive towards insulin. Okay. Autoimmune disease, type 1 diabetes, usually it is because of autoimmune disease. It also happens when the lymphocytes in your immune system, it attacks the insulin producing cells in your body. That is LADA. LADA stands for latent autoimmune diabetes of adults. Latent autoimmune diabetes of adults. So it begins in adulthood, not in childhood. Yes, not feeling full or craving for something sweet. Craving for something sweet, even after having a calorie rich food, you still crave for something sweet, or you think you will need more food. Okay, that is also a sign of insulin resistance. You don't have to eat more immediately. You can stand up, you can go for a slow walk. Just make sure your legs are moving, your hands are moving, you're not sitting. Okay, just go for a slow walk for 10 to 15 minutes, and then you will feel full. And then you will feel that I have had a good meal, I can't have anything more for the next 4 to 5 hours. Okay. So that is a trick you have to do. You are just that walk that you went for has woken up your cells, and now they have started responding to the insulin, and they are taking in the glucose that you have just fed your body with. Okay. Yes, exercise, keeping your body physically active is one of the main way to reduce insulin resistance. Hormonal imbalances during pregnancy, your placenta also releases certain hormones that can counteract insulin. Okay, you may develop gestational diabetes if your pancreas can't produce enough insulin to overcome insulin resistance. And other hormone related conditions like acromegaly, Cushing syndrome, that is thyroid disorders, can also cause type 2 diabetes. Then pancreatic damage, any infection, any injury, any stabbing wound, any surgery that or any other injury, blunt injury or traumatic injury that has been caused to the pancreas, that part of the pancreas will be damaged, it will be scarred, so your insulin production will be reduced. It can lead to type 3C diabetes, in which we call that it was not because of genetic or because of your diet, it was because of the physical damage that happened to your pancreas. Even with pancreatitis, okay, pancreatitis, pancreatic cancer, they also come under this category. Genetic mutation, certain genetic mutations can cause MODY and neonatal diabetes. MODY is also a type of diabetes that is genetically inherited. It stands for maturity onset diabetes of the young. And it can happen in young children, even after birth, it can happen. And in that, uh, it acts like type 2 diabetes, but in young children. That is what we call as MODY, maturity onset diabetes of the young. Okay, usually diabetes happens during after a person has matured, that is, they have become adult, but it is happening in their young age. Okay, so these are genetic in nature. Complications of diabetes: hyperosmolar hyperglycemic state. In this complication mainly affects the people who suffer from type 2 diabetes. When your blood glucose levels are very high, over 600 milligrams per deciliter of your blood for a long period time, and it leads to severe dehydration and confusion. And in this state, you will require immediate medical attention. You have to be taken into a emergency. Okay, when you check your blood glucose level, if it is more than 600, okay, immediately you will require a emergency treatment. Then diabetes related ketoacidosis. These are ketone bodies that are traveling in your body, in your system. Okay, because when the body is not responding to glucose, the body has started using up fats for energy. And when your body uses only fat for energy, it will produce ketone bodies. Okay, when the fats are getting metabolized, it produces ketone bodies, and they are being circulated in your blood. So they make your blood acidic in nature, more acidic in nature, ketones. So this complication mainly affects people with type 1 diabetes or people who have undiagnosed type 1 diabetes. Body can't use glucose for energy, so it breaks down the fat instead and releases substances called ketones, which turn your blood acidic. Okay, so this causes labored breathing, vomiting, loss of consciousness. Okay, this also requires immediate medical treatment. Severe low blood sugar, so that is hypoglycemia. That could be fatal as well. Hypoglycemia, it happens when your blood sugar levels drop below the range that's healthy. Okay, and usually affects the people who are diabetic. And the signs of low blood sugar is you have the blurred vision, double vision, you will be clumsy, you will start sweating, okay, you will be disoriented, and some people may suffer from seizures, that is convulsions, fits. Okay, and again, you may require a glucose drink immediately. Okay, a glucose drink with a pinch of salt is given to people who are undergoing hypoglycemia. Yes, diabetes will affect kidneys as well, because kidneys are also prone to inflammation. Okay, diabetes, high blood sugar means it's an inflammatory state of your body. So any of your organ will be affected, kidneys, including kidneys. Yeah, kidneys are trying to push as many glucose out of it. So kidneys are also getting deposition of lot many glucose molecules, more higher than the normal range. So automatically kidneys are also at the risk of developing some inflammatory disease conditions. Ketone bodies will also affect kidneys. The acidic nature of the blood can affect any part of your body, not just kidneys. Long-term diabetes complication, cardiovascular, heart diseases is the most common type. Coronary artery disease, heart attack, stroke, atherosclerosis. Okay, in atherosclerosis, that excessive fat globules get stuck in your blood vessels, narrowing your blood vessels, reducing the blood flow. Other complications, nerve damage, that is neuropathy. And this is the reason why you get that numbness or tingling sensation at the on your toes or on your fingertips. Neuropathy that can lead to kidney failure or the need for dialysis or transplant. Nephropathy, as I mentioned, ketone bodies, high levels of glucose, okay, when they attack the kidney over and over again, okay, kidneys will go into a state of inflammatory situation and it will lead to nephropathy, okay. Retinopathy, that is your eyes, retina will be damaged. Risk for cataract is also there, that could lead to blindness. Diabetes related foot condition, diabetic foot, that is if you get a wound or a sore in your toes or foot, it will not heal, okay, at all. The wound will spread so much so that you may have to cut the leg, you may have to amputate the toe or amputate the feet or amputate the leg. That is diabetic foot. It will undergo gangrene and all. Skin infections are very common. Amputations, as I mentioned, because of diabetic foot. Wound that is not healing. If the wound is not healing, it will disintegrate, it will spread, okay, it will lead to necrosis, gangrene, and then you will have to amputate the foot. Sexual dysfunction due to nerve and muscle blood vessel damage. Erectile dysfunction in men. Vaginal dryness in women. Because the high blood sugar level is causing inflammation, okay, high blood sugar level is causing inflammation that will not allow the wound to heal. Too much of sugar in the blood, because wherever you got the wound, okay, there is a blood circulation around that wound, and that blood circulation, if it is hyperglycemic blood, it will not allow the wound to heal, okay. Gastroparesis, it's a GI condition. Delayed gastric emptying, takes a long time for you to pass the feces. Hearing loss, just like how it damages the eye function, the same way the nerves of the ear will also be damaged, so that leads to hearing loss. Oral health issues such as gum disease, okay. Sugar is inflammatory in nature, okay. Glucose, high levels of glucose is inflammatory in nature. Okay, just imagine a situation where you have a wound. If you keep scratching the wound, okay, if you keep poking the wound, it will not heal. The same thing, high levels of glucose is doing from within. Okay, you have to bring down the blood glucose level for even protein rich meals or vitamin C rich meals to help you out. Okay, if you're suffering from diabetic foot or any wound that is not healing, check the blood glucose level, bring it down to normal. Okay, use insulin or any other medications to bring it down back to normal. Only then other factors will work. Then diagnosis, you can do the fasting blood sugar test. At least 12 hours you have to fast. You can have water, but nothing else. At least 12 hours you have to fast, and then you can give the test. Here they have mentioned 8 hours, but it is recommended to have a 12 hours of fasting, that is complete sleep cycle plus 2 hours here and there, 4 hours here and there before sleep and after sleep, including that. So this test will show the provider, whoever is doing the test, that what is your baseline blood sugar level. That is before eating something. Okay, you have fasted for 12 hours before eating anything. What is your blood sugar level? Is it still high or is it low? Okay, if your fasting blood sugar level is about normal, if it is more than 120 and all, okay, there are high chances that you're diabetic. Random blood sugar glucose test, that is RBC. Random means whenever, any time of the day. Doesn't matter you have eaten or not eaten, you have just had lunch or you're going to have lunch. Doesn't matter. Any time in 24 hours, when you are randomly checking your blood glucose levels, that is called random blood glucose level test. Then A1C, that is hemoglobin. You are analyzing the level of glycogen in hemoglobin. Okay, this gives you the most accurate result because hemoglobin is is been traveling in your blood since the past 3 months on an average. So from the past 3 months, what was the level of your blood glucose level? Okay, so to understand if a person is diabetic or pre-diabetic, A1C is the best way to approach. Okay. Over the past 2 to 3 months, what is the average of your blood glucose level, you will get to know. And during pregnancy, all pregnant women should be screened for gestational diabetes. Severe neuropathy can lead to any form of damage in the body, depends on where it has been affected. Okay, which nervous system, which part of the nervous system is been affected. Yes, neuropathy can be fatal. So these are the indices. If your fasting blood glucose level is less than 100, it means it is normal. If the random blood glucose test is, we don't check for the rate in random blood glucose level. If it is 200 or higher any time of the day, which means you are diabetic. And A1C, hemoglobin HbA1c test. If it is less than 5.7%, you are normal. If 5.7 to 6.4 means you are in the pre-diabetic state. And if it is more than 6.5%, which means you are diabetic. Management and treatment. Regularly, you have to monitor the blood glucose level. Monitoring your blood sugar level is key to determining how well your current treatment plan is working, or do you have to change your medication. Okay, is it making you hypoglycemic or hyperglycemic? So you have to regularly monitor the blood glucose level, because Anyone who has diabetic family members, you would know their medications keep changing, the dosages and all, it keeps changing. Okay, so it's because of the shift in their blood glucose levels. You can monitor your blood glucose levels at home also. Finger stick method can be done. Continuous glucose monitor can be used. Your healthcare worker or doctor will suggest you the best blood sugar checking method you should use at home. Oral diabetes medications. Oral diabetes medications like metformin is the most common one used. But metformin should be prescribed to people who only have type 2 diabetes, where they are still able to produce some levels of insulin. Okay, so oral diabetics medicine, it helps to manage the blood glucose level in people who have diabetes, but still their pancreas are producing insulin. Mainly, metformin will not work for type 1 diabetes, only for type 2 diabetes. Insulin, it is given for type 1 diabetes because pancreas is not able to produce the results at all. So you need to inject synthetic insulin. Some people who have type 2 diabetes will be put on insulin only if it is the critical case where metformin is not working. So the four main ways where you can take insulin is, you can use injectable insulin, you can self-inject insulin as well. You can use insulin pens, okay. Insulin pumps can be used, that you will wear, you wear it 24/7 on your arm or somewhere on your body. It will keep inserting small doses of insulin into your body. Rapid acting inhaled insulin is also available. So there are different ways of administering insulin. Diet, meal planning has to be done. Choosing a healthy diet for you is very important when it comes to lifestyle management in diabetes. You have to add more complex carbohydrates in your diet. Food greatly impacts your blood sugar level. If you take insulin, counting carbs in the food and drinks you consume is very important. You have to be very conscious about the portion sizes that you are using in your meal. Okay, the type of meal that you have. Okay, healthy eating habits has to be put. You have to manage your weight. You have to reduce with doing that, you have to reduce your heart health diseases risk as well. Exercise, physically be active, because only physical activity can wake your cells up and make them sensitive to insulin. When the cells become insensitive to insulin, they don't respond to insulin. To wake your cells up, you have to be physically active. You have to exercise. Okay. Even just go for a brisk walk for 45 minutes or 1.5 hours. Okay. That is also enough. Body movement, body that is moving. Okay. Some moderate or low level cardio is also enough. That is walking. Prevention, autoimmune diseases like type 1 diabetes and genetic diabetes like MODY and all, that you cannot prevent. Okay, but type 2 diabetes, gestational diabetes, you can lower your risk of developing these. Okay, by eating healthy like Mediterranean diet. In India, it is really impossible for Indians to follow Mediterranean diet because we also use a lot of vegetables and fruits in our diet. In Mediterranean diet also, they have a lot of fruits and vegetables, a whole lot of green leafy vegetables and fruits, but it is raw. In Indian diet, we the vegetables and fruits and everything, apart from fruits, the major part of the vegetables that you eat is cooked. Okay, the only raw form of vegetables that we consume is hardly cucumber or maybe a raita. Okay, apart from that, or sometimes if you go to a hotel or something, you will have a side salad of a onion or something like that. Okay, but usually Indians don't prefer to have raw vegetables. It is always cooked vegetables. But Mediterranean diet, major composition of their diet is vegetables and green leafy vegetables, fruits in raw version. Okay, so that is very difficult to switch to. Getting physically active at least 30 minutes a day, 5 days a week. If you're physically active, your cells are more they will respond to insulin better. Work to achieve a weight that is healthy for you. Healthy for you. Okay. And manage your stress. Stress can also cause diabetes. Limit alcohol intake. Sleep for at least 7 to 9 hours. And if you have any sleep disorders, seek treatment for that. Quit smoking. Take medications as directed by your healthcare provider every 3 months, once in every 3 months. If you are dealing with a diabetic patient, every 3 months at least they have to visit their healthcare provider to see if any medications need to be changed or doses had to be adjusted or not. So that's about diabetic mellitus. If you have any other queries, you can mention in the chat box.